Hey y'all, let's go to Rome. So today we'll be talking about ABG or arterial blood gas interpretations. So when it comes to ABG interpretation, always remember our pH levels are our star player. That means that we're constantly trying to maintain a state of balance of our pH levels. So, what is the normal range of our blood pH? The normal range of our blood pH is 7.35 to 7.45. If our pH levels are less than 7.35, that's considered acidotic. The patient has too much acid in their blood. If the pH level is greater than 7.45, that's considered alkalosis. The PaCO2 levels is our carbon dioxide and it's regulated by our lungs. Our HCO3 levels is our bicarbonate and it is regulated by our kidneys. So when it comes to the Rome method, it's trying to help us determine whether the patient condition is coming from the lungs or if it's coming from a metabolic condition. So when it comes to the RO portion of the Rome method, that means respiratory opposite. Remember, our pH is our star player. So that means that our CO2 levels are opposite of our pH levels. So if our pH levels are low, that means that we're acidotic, and our CO2 levels are high, that means that the pH and the CO2 levels are opposite of each other. That means that we're in respiratory acidosis. And vice versa. If our pH levels are high, that means we're in alkalosis. And our CO2 levels are low, again, that means they're opposite of each other. That means that we're in respiratory alkalosis. This lets us know that the patient's condition is coming from the respiratory system. When it comes to the ME component of the Rome method, that means metabolic equal. Remember, our pH levels are our star player, so that means our HCO3 levels are equal to our pH levels. Meaning, if our pH levels are low, which is acidosis, and our HCO3 levels are also low, that means